Obvious. Well, here we are. We're live. America. We're live again with Al Guida Jr., who, as everybody knows, is now our favorite lobbyist, who showed up on our show about 2 months ago to tell us about how the SAMHSA grants were all saved. So he was a very popular guest with our loyal fans, and he's back. And I think
did you guys know that there is a mafia war in my ancestral land of the Barese mafia? So just a little Italian lore for you on this highly Italian influenced talk show.
You don't want to go down the road of Italian American stereotyping. You know what I'm saying?
I live right off of the James Gandolfini Highway, guys. I'm being serious.
We can talk about the Italian mafia wars, Kat. We could just skip all this health tech nonsense.
If you want to,
Oh
I feel
God.
like you've given me enough time to be hyper pro Ukraine. So if you want to
That's right.
talk about the Italians, you guys can do that. I'll take a little break.
I love that.
Yeah. Okay. Well, we got Al back. There's a lot going on too. So Al, you know the rule now. We're gonna stick you in the back. Although I feel like you would not mind being involved in our banter.
All good. I love it.
Yeah. So you just pop back on if you see something you want to talk about. Right? You just let us know. So we'll get you back on at 3:30. We're gonna send you back here. Melissa, what's new and exciting? Love your background. Love your house.
Thank you. That's what I aspire for. Nothing. Did you guys see that one of the people that were on the ship is being quarantined in New Jersey? Just FYI, I saw that today.
No.
Oh, that's so exciting.
We're going to talk about it. Although
big Ebola vibes.
I have yet to confirm if it's Hanta or Hanta.
Hanta virus. We'll just say that.
We're going to say Hanta because it sounds better, I think.
Yeah.
Is my personal opinion. So we're going to talk about that. Yeah. Everybody give Melissa money if you have any. Yep. Call her up. Do the thing. All right. We'll send her back. All right. So it was Cinco de Mayo this week. So that's why here Lisa and I are, I guess, drinking margaritas. We're drinking some margs. I'm not sure. Thanks, Max. Good job. All right. Highly festive.
We're so hantavirus.
So we've got a few more boring AI things. They're not actually boring. We got some stuff up front about AI, and then we're going to go into all the other crazy stuff that happened this week. Hold on. I got a stat. Oh, okay. I was hoping Stat was going to say whether or not
confirmed
is officially fired. It's just another one saying reportedly planned. So we'll get to that later. But anyway, Lisa, you posted this, and I think you posted it with like a LOL type of emoji. Basically this guy is saying it's malpractice if a doctor does not use AI. Do you agree?
I did not agree. So this is a YC company, Legion Health, who spam me frequently on the LinkedIn and try to contact me and connect with me. I'm sure they're nice kids, but this is bull honky, if you ask me.
Nice kids. These are nice kids.
Wow, nice kids, but no.
Yeah.
That is not like isolated diagnostic accuracy in very limited test simulations is not the measure I would use. That's the nicest thing I can say without cursing.
I kind of agree. I'm pro AI, but I'm also not dumb. So
I'm
I don't know.
Anti-AI. I'm just not dumb is kind of the best thing. That's the less nice thing I can say.
Yeah, I think that's great. Yeah, but this was an interesting study that they did cite here that I only half copied. But yeah, basically a bunch of AI appropriately diagnosed stuff in the emergency room or something like that. Okay, whatever. But
Legion Health, importantly, Legion Health is the second company after Doctronic, I believe, who have a preliminary agreement or ability in a limited test AI prescribing in Utah. And they are focused on psychiatric drugs, which is a real risky place to be testing this stuff out. Yeah.
Well, that is crazy. I'm actually interested in that because isn't the administration...
No, I am too.
Aren't they currently we overprescribe those things? Don't do it. Basically go change your lifestyle or some BS like that last week. And now we're into this.
Well, so these guys are like, they're like, their whole thing is like, there aren't enough psychiatrists. True. And
True.
there's like limits to, like there's a real shortage. It's really hard for people to access like appropriate psychiatric care. And often psychiatrists now are just solely focused on like short appointments for like $12,000 per 20 minutes to like prescribe psychiatric drugs. And so they're like, what can we do to help with this? So it's not like they're not like wrong, but I mean, talk about a risky area. I'm really interested to see how that one plays out.
Did everybody forget about cerebral?
I love cerebral. What a great story
I feel like we
of
forgot. Like so the plan is
trash.
here. We would just replace the nurses or the NPs and
Humans
whoever.
are inconvenient and expensive. I would like you to spend that money on my AI instead.
This is like cerebral AI, and still, obviously, this company is incentivized to turn out scripts. So how would this end up different? Just saying. I don't know. I mean, I'm often wrong, never in doubt. So
listen, Legion Health, if you are insulted by me calling you a nice kid and whatever else, like come on the show and tell us how you're not cerebral with AI.
I do want all of them to know that we are elder millennials and Gen X. Lisa is Gen X. What? By like 1 year?
I mean, it depends on your definition, but I'll take it. I own it.
Yeah. So basically, everybody is a kid. We're like those ladies now. We're like we can't wait to report on the menopause.
You kids.
You kids, come on our show. We actually have actual kids coming on our show in like a month.
So excited for that. I can't wait. I can't wait.
I believe they are graduating high school students who wrote us an incredible pitch. So you'll see
you
them.
guys.
Yeah.
Preview, rare preview of the show because we usually don't plan ahead. So
I'm sorry. I just need to say that they could not come on the day that I provided because it was their final exams for high school. And they're coming the following week, and they are just amazing.
Oh my God, I'm so excited.
I love it. So
we're excited for these kids.
Yeah,
we are excited. We don't even know. What's
rare
going on,
rare pre-planning from us. And by us, I mean Melissa. And so yeah, very exciting.
Yeah. All right. Moving on to more AI stuff. So speaking of AI doing things it shouldn't do. Our best friend, Governor Josh Shapiro, he is shutting down or attacking or doing
future
something
President Josh Shapiro.
Yeah,
future President Josh Shapiro.
I mean,
what up?
I do love Pennsylvania. Everybody knows that. But apparently, this chatbot was telling everybody it was an actual psychiatrist or a psychologist or something. It was an actual doctor. And it was basically impersonating a doctor, even though I guess in the T's and C's, it was like, no, we don't do that. But if it's saying it is, it provides a fake NPI.
It's like, real bad. It's 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 real bad. Yeah. Nobody reads the T's and C's, guys. So like definitely tell your chatbot to not give a fake license number. Thanks.
Yeah. Cool. OMG. So yeah, I mean, the point is like, don't always believe what it tells you. Okay. Other AI stuff. So Lisa, you sent this to me as well. And you're like, hey, there's a new job on the town. And it's like director of how to use AI.
So Palantir invented or whatever decided to call like field engineer, like a forward deployed engineer. And now like Aaron Levy from Box, who was like, we're an AI company now, was like, oh, the new job is like agent deployer. So I'm like, software engineer? like, can you like, if AI is just becoming like custom, like software as a service that's like developed and deployed like at enterprises, and we need to hire a bunch of new people to be the agent deployers, then is it just software is dead, long live software? Like I got a real lol out of this one, and this is like, come on, man. I mean, whatever, and maybe that is what we're doing, right? Like we have the ability to build better custom software that is more customized to enterprises, and like SaaS at the enterprise level is dead, and that's true in healthcare as well. Over time, healthcare will be like 10 to 20 to like 50 years behind everything else, just to be clear.
We're still
Yeah.
working on we're doing a lot of Excel spreadsheets still over here. So like, I mean, we're going to, hard to do. Yeah,
got a good roll out of this
love
one.
that they're an intelligent content management platform now. I will also say, did you see that Allbirds, the defunct shoe company, has rebranded itself as an AI company?
So that's not really true. They like sold the shoe part off, and then they're like, well, we still have a company. We're still registered in Delaware. Now we're an AI company. Okay, whatever.
I mean, it happens all the time. I heard
happens all the time.
I mean, who knows? People could get in on that. Okay, so next exciting piece of news for the week is that hantavirus is coming, and apparently it's bad, but also not a threat.
Also not. Listen. My big feeling here, like, is just holy smokes. Like, I understand that we fully defunded the CDC, but like, I remain incredibly disappointed in the quality and the clarity of public health communication in the world. WHO, UN, like what the hell, you guys? Like, what the hell? Like, it's so disappointing. It's so disappointing.
Here's what we got. Lisa
so
sent
disappointing.
This is our fact sheet from the WHO, which, by the way, we pulled out of because like we were like, we're better than you, or I don't know what we actually thought, but this is what we got. A fact sheet.
I just like, are you freaking kidding me, you guys? And like there is an urgent need in the world for really like not yet. Go back. For clear, like, authoritative communication that clearly says what we know, what we don't know, what might happen next, when you will hear from us next. Like, truly, I don't know. Like, I am putting out a plea into the universe. Please, anyone who is freaking talented in communications, you are needed. There is so much trash out there. And the people who are in power in these positions at the WHO, at the UN, at the CDC, whoever that is, I think it's RFK, you need to communicate extremely proactively with people in a authoritative, knowledgeable, and approachable way. You need to.
Yeah, but like, Lisa, this isn't even our problem.
It is.
Well, yeah. Well, like Melissa said, apparently one of the patients on the cruise ship is actually being quarantined in New Jersey.
There were 17 Americans on the ship, dude. This shit is global AF. It is all over the world, and it's fine. Like, I think honestly, like, now you can go to the screenshot and then I'll say famous last words. I think it's fine. Go back to the screenshot.
I think it's fine too. Okay, so America, in case you haven't heard, like, a bunch of people went on this cruise ship, and like it started in Argentina, and apparently it's visiting small little islands, obscure islands. It's a long cruise. I guess it sounds like you can kind of get on and get off wherever you want. It's confusing.
There are a couple stops.
It's like one of those buses in European cities, or I guess everywhere where you can hop off. It's confusing. And it turns out like a bunch of people are dead and a bunch of people got it, and like, what? And they are everywhere.
It's not a bunch of people. It's 3 people are dead, but sure.
That's, whatever. Anyway,
I'm not 3 people contracted the virus and got really sick. One of them died on the ship. 2 others died outside of the ship. They were all very close contacts. And by the way, they got the virus in a garbage dump in southern Argentina. And that is where there are mice and rats and mice droppings and hantavirus.
That's kind of gross. Yeah. Like, when I first heard this, I was like, isn't that what a few hikers got on the Appalachian Trail? Because their faces were stuck in rat shit in one of those huts.
That's like, how you get it.
Gross. So like, that's not great. But also, apparently, like, I guess a flight attendant or someone who was on a plane with someone.
She didn't get it. She was tested.
Have it.
She was tested, isolated.
Sick.
She was just sick, which happens.
I don't know. But the point is, this is like yet another reason why maybe we shouldn't have abolished the CDC. But here we are. But Lisa's telling us this is no problem. Also, do you know who else is telling us it's not a problem? MTG. our girl, she said, hey,
Noted public health expert.
hey, yeah. So speaking of clear communication, she was clear, Lisa, and that's that just take the ivermectin and you won't get the hantavirus. Like, so I don't know if you
Please
still have
don't do
any.
this. Guys,
I don't know if you
non-medical
have any,
advice.
but I
Non-medical
think
advice, but
I
don't
think
take
we should
ivermectin.
all stock up. So it's confusing, but you know, we'll see what happens with the CDC. We kind of don't
Does
have
she
anymore.
know that it's a virus, not a parasite?
Lisa,
I'm just curious.
She heard from an internet
Cool.
doctor
Oh, that's
that
good.
the
Oh, that's fine.
ivermectin, that apparently
fine.
it's an RNA virus. There was like some and I was like, well, I don't even
Correct.
know what this is.
Ivermectin is an anti-parasitical parasite drug.
Of clear
No
communications,
parasites.
MTG, she's getting a lot of play. Okay, so Lisa is typically our expert on all this stuff and everything, but she also, this was not my idea. She sent this to us. This is a text with her sister, where Lisa is the texter, and apparently your sister sends this every time you try to be a smarty pants. This is Lisa telling her sister that the coronavirus, COVID-19, was no big deal. Basically, Lisa took the stance of this is like the flu, which, by the way, is the same stance I took.
Okay. Context. This was like in January 2020, y'all. January 2020. Imagine me flying across the world. I was flying back to the US to go to the ONC conference, which is a very bad reason to fly to the US, just to be totally clear. Sorry, love you, ONC, but like, whatever. And this is what we knew then. But every time I say anything about anything, my sister sends me the screenshot to be like, you are wrong. So, you know. I do think this is good advice, though, just to be clear, get the flu vaccine, wash your stupid hands, and don't touch your eyes and your face.
I mean,
do it anyway.
That's like
do it anyway.
Also,
thank you.
Put your face in rat-infested areas.
Yeah.
If you can help it. If you can help it, that's probably the move. But
mice and rats just like really like have just continued to plague us literally and figuratively for so many thousands of years.
Yeah.
Shout out mice and rats.
Anyway, well, you know, loyal fans, we'll keep you updated on our fake news show with fake information about the hantavirus. We'll see what happens.
This should be a good example. Like, don't trust. Again,
not
medical advice,
doctors,
not
even real media,
not real public health people. We're just whatever.
We're just an unqualified bunch of people on the internet. So though I will say, I feel like we're doing better than our girl MTG because we are not.
I think this is sound medical advice. Yeah, I agree, Melissa.
100%. But
we agree with us.
We are not recommending ivermectin, which I think makes us more credible. So whatever. Okay. All right. So crazy. Okay. Boy. Lisa, so maybe I'm paying more attention because, you know, we're in healthcare. This week has been quite the harpooning of Marty Makary. Holy shit. Let's just go through. So this is earlier in the week. This was an op-ed over the weekend in the Journal. It was basically like, this guy's basically the devil. Then it's talking about more staffing changes and how much, this is like the next couple, Cinco de Mayo, Margarita Day. And then they're like, Trump was like, go approve those vapes, especially the fruity ones. And Marty was like, okay. I'm sure it wasn't quite like that. And then they're like, fuck this guy. And then they're like, actually, the guys who blocked that study, that was the FDA. Screw those guys. And then it just keeps going. Am I out yet? Oh, and then it's, screw that guy. He's not legalizing abortion drugs or whatever the hell. And then he's criticized for the commissioner's waiver. Holy shit. Are we even done yet? And then a few hours ago, we get
a real journey. It's a real journey.
The summary down here, as you can see, President Trump has signed off on a plan to fire FDA Commissioner Marty Makary.
By the way, who the hell? I remember how we talked about last time about who is leaking this shit, because you should be asking yourself, like, what in the
campaign?
This was a text from the president to the Wall Street Journal, I feel like that. This is just
I don't like him anymore.
Come on, man. Like, What the
No, I
hell?
mean, it's crazy. Well, and some of this
Oof.
stuff. So, like, actually, I thank you, Commissioner McCary. I don't actually know how to say it.
McCary, I think.
McCary, thank you for not unapproving mifepristone. That is cool. Appreciate you. And I actually, I tried to read into the whole like why they withheld the studies. It actually doesn't seem as awful as it sounds, which again, Lisa, goes back to the whole like who's leaking this shit out. And wow, what a great spin. Because this actually originally was like CDC holding it back. And now it's like, no, it was that guy. And it's like, what? But it looked like there might have actually been semi-legitimate reasons that they did not move forward with, or it was in peer review and they pulled it back. And there were various reasons for that that seem like, if you squint, are legitimate. It's confusing. And then, yeah, the vape thing. I mean, what the hell? Like, this is kind of silly because Trump said he did not want the vapes, and now we want the vapes because apparently
Trump has said he wants to save the vaping industry, which was what he said that a few times.
I thought he originally was like vaping is bad.
Well, he's gone back and forth. To be fair, he's had different perspectives here. I mean, just to be clear, like
I have good perspectives too.
Vaping is we talked about this before. We talked about vaping in the past as well. Like, like maybe legitimately good for people trying to quit smoking, but like obviously when you're like candy, vapes for kids, like maybe not.
Well, I mean, this was potentially a not great source in I think it was the New York Post, which, is marginal at best, but it was like, yeah, Trump wants the vapes because young MAGA Republican voters like the vapes. And I was like,
cool.
Wow. Okay,
cool.
Sounds good. But yeah, Lisa, you know what I think? I think this is my theory, the Cat McDavitt theory. To be clear, I know basically nothing about the FDA. I don't deal with the FDA. I think like all these pharma companies were like, we were nice to you, Trump administration. We got up there and like one of our guys passed out on stage or whatever, but like we gave you all these great prices and now we don't like this guy because he doesn't approve our stuff. That's my theory.
Yeah, I mean, reality speaking, like if you start to, make people think that FDA approval means nothing and is not safe, then it will mean nothing and not be safe. And that is really, really dangerous. Like we need to be a leader. And by the way, FDA, for better or for worse, at least was a leader in the world. Like FDA approval meant something in other countries, and other countries like would just literally model their programs with like a very light review of like what the FDA was doing. And so if we lose that, like, yeah. Again, like it's got to mean something. It only means something if it's free from like interference from the administration, like a text from Joe Rogan. That is not an acceptable way to like approve a product.
Well, this is also, I mean, this is awful. Like this quote here.
This is so bad. So bad. So
great.
bad.
Do you want FDA approval? Like, yeah. And I do feel bad for our commissioner here because you're kind of like, you're in like the same place Susan Menares was in, right? Where they're like, oh, you're supposed to like stand up for the right thing for America, but you know what? You better approve the vapes or the psychedelics or whatever it is. And like, we don't care if you care about science. And so like, yeah, how do you walk that line? It sounds like here you can't.
Yeah, I think here you can't. And this is a real route. And remember, we talked about this, I think last week or week before or whatever, like if the president is going to replace any of his, agency heads, he's going to do it right now because now is when he can get new people in and get them through Congress, through the Senate, right? If they have to be Senate confirmed, before things really start to go down with the midterms. So if he's going to get rid of folks, it's now.
Yeah, well, and a loyal fan just texted in, but like, who is even the bench to run the FDA if Marty leaves? I don't know. Like, I haven't heard anyone. And again, I don't do much with the FDA, like as anything, but like, I haven't heard that there's someone waiting around to take this job.
Marco Rubio seems to be free.
Oh yeah. Well, Lisa, he
can also run the FDA.
Spirit Airlines back to life.
Oh my god! Oh my god!
By the way, have you seen all of the photo ops
Chris could take a new job.
I don't know. Like, I assume it's hard to run the FDA. Like,
I think it's probably really hard.
Like, I don't know. I don't know. I
don't want to do it.
I'm sure there's. Well, didn't they like even with Pam Bondi? Wasn't it like her deputy they put in? Like, I'm sure there's smart people there who can do these things. I just don't really know how it works, but yeah. So wow, this was like, again, quite a harpooning. Like no joke. And last week we were all worried about the health tech ecosystem getting harpooned, but this was a much more harpooning. So yeah,
much more significant significant impact on like
so bets,
healthcare, device, drugs.
Do you think he'll resign, or do you think he'll wait to get fired?
I'm pretty sure he's probably already fired. It's just not public yet.
Yeah.
I think it's done. I don't think you walk back from that.
Do you think he's going to take an exciting private sector job?
Yes, I'm sure.
Looking forward to hearing the news. Looking forward to our political alerts. Okay. So we'll see what happens there. All right. So speaking of people coming and going, apparently Maha, which we've already determined might potentially be sort of fake, at this point, is very mad that Casey Means was withdrawn, and Dr. Safir is now the new nominee. They're mad. They're mad because she might be more legitimate.
And apparently she also had some tweets that she deleted that were critical of the president in the past. So I'm not sure how she got to the like nomination table without them sort of going through all of her past tweets, but apparently she deleted some.
Well, I don't know. I don't know about that. I think it is weird in this administration to have someone who is kind of critical, but in the past, it's kind of not been a bad thing to have your own opinion. So I don't know either. Maybe they just didn't know that.
Yep.
Unclear. But we'll see what happens. Maybe, again, I don't really know what the Surgeon General does other than like do PR campaigns on stuff. So I don't know if we need one. But I also don't know.
I also thought we needed a CDC director. So I'm wrong about all of the above.
Well, we might need a CDC director because the hantavirus is coming.
Does this lady need a new job? Because like we need somebody.
We might need to put some people
right away.
In there. It's confusing. We'll see.
I
mean, maybe she wants to be the FDA commissioner. I don't know.
Yeah, there's lots of jobs open right now.
Jobs open. We'll see what happens. Yeah. Okay. So last thing we're going to end on before we go to our favorite lobbyist. So this was all over the internet about hot spanning, mostly for men. So you no longer think about your health span; it's your hot span. Lisa, I would just like to say, women have been under pressure to look good until they
cry me a river.
So sorry, you guys have to like be in shape now and not be gross. Like I don't know what to tell you.
I am not. I have no sympathy whatsoever for this one. But welcome to the party.
Yeah, welcome to always thinking about what you look, because if you're too hot, you're definitely sleeping with someone to get what you want. If you're too ugly, well, you just don't even get in the meeting. So I don't know.
Yeah.
Welcome to the club, y'all. Happy
find
to be
that
here.
right. You got right.
You can't be too hot.
Perfect
can't
medium.
Be too ugly. It needs to be kind of a thing. You need to spend at least a little bit of money on Botox. Maybe.
Yeah.
I don't know. Or you could be rich. I feel like you could also just be rich. I don't know.
Yes. It mostly applies to men, but not exclusively. So, it's great. And if you are rich and you're a man, and you can also invest in in some of that Botox or some of those styling haircuts, taking a shower at least once a day.
Yes.
Moisturizer. Moisturizer. That is, if any men watching this want any tips, it is you need to both exfoliate and moisturize your skin. Let's just be clear. Everyone. Doesn't matter your skin color, your skin tone, your race, your ethnicity. Everybody needs to help your skin exfoliate and then put some. Yep. Whatever it is. This is just a public service announcement from me to you.
So we can help you hot span.
We're helping you hot. Your tip from the Health Tech Talk Show is to exfoliate and moisturize. Oh, sorry, Melissa's also saying retinol. Retinol's advanced. No. It's too much. It's advanced. It's advanced.
I'd say for most women it's not advanced, but I think for
we're not talking about women here. We're not giving tips to women here.
I feel like retinol is good. Like sunscreen is ideal, right? Like I don't know, just. And then like GLP-1s are the great equalizer, right? So you need to lift weights because strong is the new skinny. That's what I read on the internet. So
you need to lift weight. Everyone needs occupational therapy, including me. I can't tie I can't tie things very well. Like I feel like I need like some
What?
kind of occupational
Are you
therapy.
losing
I'm just not.
finger mobility?
I need like everyone as we get older, we all need occupational therapy to like climb stairs, to get up out of bed, to whatever. Like people,
Well, as we previously stated at the
fall
beginning of this
prevention.
show, we are allowed to say you kids to anyone younger than us because, as
That's
Lisa
right.
has
Now,
just
now,
noted,
now we're old enough
we
to say
now
you
need
kids, you kids.
occupational therapy. Like we're using like the OT on our show
OT.
along with the menopause.
OT.
Just saying, I know we look good because we're hot span maxing or
We're
whatever
hot
it
span
is,
maxing.
but we're actually quite old. We're actually quite old. We like know some stuff.
Oh,
So,
good
okay,
times.
Lord Almighty.
Good times.
Okay, where's
Good times.
Al? Al, yeah, come on,
Al, help us out. We are losing
save
it
us
here.
from ourselves, Al. What are we even talking about? Are we talking about the AI?
Well, Lisa, before we get to the AI, I'm still trying to understand where you put your face so that you come into contact with rats and mice droppings.
That's the
This
thing.
was on the Appalachian Trail. Kat was saying so there's on the trail there's like huts, some huts that people stay in, but they're anywhere where you have like unchecked like mice and rats and whatever, like you're gonna have mice and rat droppings, and that is how the hantavirus is spread.
Okay, but how did they get it in the dump
And mice?
in the island on the
Oh,
boat?
so are you talking about in Argentina? So Argentina. This ship was like a like rich person's like explorer, like very small islands for bird watching primarily. And there is also apparently good bird watching at this like dump in Ushuaia in southern Argentina. And these people, this Dutch couple, were out there doing their bird watching, and it was at a dump. And unfortunately, that is a very bad place to not contract the hantavirus. So unfortunately, they did.
Not great.
Why do we go to a dump? Well, I mean, that's another matter.
Amazing bird watching.
Breaking news that's not breaking news. The breaking news is that this is from a legitimate, semi-legitimate source, y'all. Someone connected. The Marty getting fired news is fake news.
What?
That's what he said.
All right. That's what they said. That's what they said.
Well, whatever. Everybody in charge are men, so whatever, Lisa. It's like not giving anything away. But this person does not work for the administration, so he could also have fake news on the fake news. So
all right. Well, you know what, Marty, if you could stick it out, we support you. 2 thumbs up.
Ow.
Well, look. So Kat, let's start there. Let's start with Commissioner and Joe Rogan, and I do have some I guess some gossip. Well, I just
we're here for it. Oh my God.
I just want to clarify the situation. So yeah. Now the second time today that I'm discussing this text, and so there was a text, there was a phone call apparently between the president and Joe Rogan, but this was very specific now. So this related to psychedelics and to ibogaine and psilocybin, and so this was related to the executive order in late April that basically sped up the approval process for psychedelics to come onto the market. Now, just to defend the FDA commissioner, I'm not going to defend Joe Rogan, but just that, and he's probably, there's something called Americans for Ibogaine.
I've heard about this. Yeah,
I didn't even know that until about 2 hours ago, right? so Americans for Ibogaine has Rick Perry as its president.
Oh, right on.
And so ibogaine is a psychedelic, and it's hard for me to believe that Joe Rogan just does this out of the goodness of his heart. I'm assuming that there might be some financial exchange there, but I don't know that. It could well be that just as a public citizen, Joe Rogan has decided to lobby the president on this matter. Okay. Now, the text and then the executive order did not grant FDA approval to either ibogaine or any of the psilocybin products that we're talking about here. Okay. The voucher granted a
clinical trials, right?
a fast track product, a fast track approval process. It didn't grant approval. So what that means is that typically when anybody, a pharmaceutical company or these psilocybin companies submit their application, they submit a single application on a single day, and then there is a gathering of the, what do they call it there, an advisory committee, and then they will examine the application in public. And then typically they will take witnesses. And then after that, they will make a determination about whether or not that product is safe and effective. Now, in this case, what happens with a fast track process is that, pursuant to the voucher that was granted because of Joe Rogan's text, is that the company's able to just submit data on a rolling basis behind the scenes to the FDA as it becomes available in their phase 3 trial. And then, as I understand it, there may not be an advisory committee. The FDA, once all of the phase 3 data is submitted pursuant to this behind the scenes voucher thing, they may decide, hey, we kind of like this. You've submitted all your data. It looks good. It's fast track. Boom, it's approved without the need for a public advisory committee process. That's my understanding of what the voucher permits.
And like, how much faster is it than like in months or maybe years than the traditional process?
It's because it will cut months off the process, certainly.
Okay.
The process that I just described to you cuts months off the process. And then what happened with the last psychedelic process is that was a public advisory committee process. It kind of fell apart in public.
Yeah.
And what happened is that, whoa, baby, once they had to defend their phase 3 trials in public, that's when all that stuff came out. Well, there was sexual assault, and some of the clinical trial processes were not double blinded, and they really couldn't defend that you really didn't catch a buzz in the control groups, and because it was in public, they really couldn't defend the prior Lykos product. Now, I suspect that advantages you in this specific context, right? Because when you're a pharmaceutical company, it's just and it's a non-psychedelic product. There's kind of less, it's less. There's less stigma associated with it, right?
Yeah.
It's
Yeah.
I suspect you don't want to have to make a public showing when you're a psychedelic company. It's just my guess.
So the ibogaine thing there was an article a couple weeks ago in the New York Times where they went into they covered the Americans with ibogaine thing, the Rick Perry stuff. They also had a New York Times reporter who had like a personal experience who went to one of these like clinics in Mexico where they do the ibogaine therapy, and he described it as a not fun experience. It's not a fun psychedelic experience in air quotes. It's like a therapeutical, like really intense, very physically challenging. And the Americans for ibogaine or whatever, they're really focused around the treatment of like treatment-resistant PTSD, really focused around veterans and things like that. And so I think there's something to it. I just don't. I also you would want there to be real, clinical trials that have rigor, scientific rigor behind them.
Oh my
I
God.
think we're Americans. We should be able to do what we want. Take any drugs.
Oh, sorry. Kat's give everyone ibogaine. It's fine.
It's if they want it, come and get it. Live free or die.
All right, so it's a situation where the fact
not medical advice. Not medical advice. Do not listen.
Show.
No one listen to Kat. No one listen to Kat.
Right, so the idea that you've got this fast track voucher doesn't necessarily lower the scientific standards. At least in theory, the standards are the same. You still have to prove safety and efficacy. Bottom line, right? Now, and then in the case of ibogaine, the concern there is, and I don't think it's the case. So there are at least 2 other products that are in phase 3 trials that got this voucher, that got these vouchers, and that are submitting their data. Now, the difference between those products and the ibogaine product is that the ibogaine product has cardiac.
Yes, they even in this thing they were describing, the guy in Mexico, they had to do like all of these tests before they wouldn't let anyone with any kind of cardiac issues in. Yeah.
So as a result, so what that means is, right, so once you administer the product, then there's like a 4 to 8 hour observation therapeutic period after you administer the product. That kind of means you have to have like emergency medical technicians or someone with cardiac experience on that team to observe you. Okay. And that's going to raise the price. It's gonna, you gotta have someone with knowledge of heart attacks, essentially, right?
Mm-hmm.
So be able to monitor the patient to ensure that you don't have a heart attack. And then if you get into cardiac trouble, they gotta be able to call 911 to get you to a hospital, right? So and you've got to be able to screen for those patients so that they don't get ibogaine, so that they don't get a heart attack, right? So the other psychedelics don't. But here's the thing, Kat, Lisa, the reason why these products are valuable is that PTSD, treatment-resistant depression, like the indications for these products, in the mental health and addiction treatment field, we have a hard time treating these conditions. There aren't readily available psychotropic medications for them. That's why these psychedelic products are exciting, is because we don't have good treatments for these conditions today. So the fact that there was this text and what have you, it's kind of unfortunate, because it kind of, it gives a kind of like a backstage kind of,
it's a good thing, but it looks scuzzy.
Yeah, it kind of makes it look like there's a kind of like a Hollywood aspect to it, and that's it kind of hurts the credibility of it, right? That's
well, and isn't this also a wonderful thing? Because I know that there's been lots of different grant programs that have tried to look at once and done therapies for behavioral health issues, and it's hard to get those done because companies don't want to make those things, because once and done equals less margin. And so it's hard to even get these things going. So overall, a good thing.
Yeah. Well, and then Kat, what's not obvious from the press coverage of this stuff, these are not one and done. These are not like Hail Mary. Oftentimes there've got to be multiple treatments for these conditions.
Mm-hmm.
So a lot of times it's not just a single treatment with ibogaine. It's not just a single treatment with psilocybin. Oftentimes you're going in for multiple treatments for these conditions. So it's not, these are not just one and done treatments often with these the psychedelic products.
Yeah. But generally you think this is a good thing. It's just, you don't like how it's been colored.
Oh my God. Yeah. And then look, how do I say this in the English language? The armamentarium, the total amount of medications available for mental health and addiction treatment conditions, the technical term for it is they suck. So that's why we need these, because they abandoned the field, right? So the pharmaceutical industry abandoned organized psychiatry like 10 years ago, because it's just hard to hit home runs. The brain is the most complicated organ in the body, and so they just bailed out of it. And then because cancer, heart disease, diabetes is just easier to make progress.
Obesity. Lisa, you know what I think about that?
GLP-1s act on mental health because it acts in the brain also. There's so many things.
But they rebranded them to be obesity drugs.
Oh, yeah.
Yeah,
It's easier to make progress on those.
You make money.
it is on schizophrenia and then depression and all that stuff. Yeah.
Al, I need you to talk about the Dear Colleague letter from RFK Jr. and the talk about
Tell
that.
us more. Tell us more.
Oh my God. It was like the, it was like the bar scene from Star Wars. Oh my God. Oh my God. Oh my God. Oh my God. So I just
say more.
Yeah, say more.
Please.
What was unfortunate. I mean, it's one thing for the MAHA Institute to say this, right? It's another thing for, high-ranking HHS officials, and then for the secretary to be there, right? So I think the concern here is that.
Tell our loyal listeners who may not be as versed what it was. Give us the background.
Okay, so on Monday of this week, the MAHA Institute held a nearly day-long event, 9 to 4, on overprescribing of psychiatric medications. And so there's the MAHA Institute, well, I guess, which is a nonprofit entity.
I think, isn't it run by RFK's blood relatives?
Well, it is an RFK.
It's in the family. It's in the family for sure.
It's in the fam.
Well, it's run by RFK Confederates. Let's put it that way. But it is a separate entity from the Department of Health and Human Services. All right, it is.
Right.
But and it has run activities on other topics since the start of the Trump administration without HHS officials participating. But in this case, there were senior department officials, Department of Health and Human Services officials that participated in the program, and then the secretary made remarks during the course of this 9 to 4 extravaganza. And the concern here is that, so it was focused on overprescribing and tapering off of what was billed as tapering off of antidepressant medications, otherwise known as SSRIs. Okay. That's where we began.
Selective serotonin reuptake inhibitors.
Exactly. That's where we began the conversation. But then as we got further into the bar scene, it became tapering off of all psychotropic medications, the entire world of mental health medications, antipsychotic
and
medications,
eat more red meat.
The entire world of it. And so I just think, man, oh man, so the concern here is, if you were watching that broadcast or whatever they call it, they don't call it, they're not a broadcast now. If you were watching that live feed or what have you from your living room couch, and you had you were drinking like lemonade or something, that you would just say, okay, today I'm going to stop taking my whatever psychotropic medication there is, because the secretary.
Don't do that. Let me just interrupt to say, once again, we are not medical advice, but do not do that.
God,
dear Lord, please don't.
Is a good way to decompensate into a psychiatric and wind up in an emergency room. So do not, if you're watching, if you're listening, do not do that. Should you decide that you may want to do that, please contact your physician, because it's not and just
safe. So it's not, in technical terms, it's not safe.
It's not safe. Oh my God, no. Oh my God.
The Star Wars bars.
It's quite the opposite. Right? It's quite the opposite, right? So so just in the substance use space, right? So we don't have that many medications in the substance use space. We have buprenorphine, we've got methadone. There's an agonist that is an injectable. Okay, 25% of Americans with opioid use disorder are on that medication. On these medications, 75% are not. All right.
Wow.
So persons with severe mental illness, we serve 55% of that population. Where the rest serve? County jails, homeless shelters, and emergency rooms. That's where we serve the rest of these individuals. Okay. So it's quite the opposite. Overprescribing may be a problem, but the vast majority of people that could benefit from psychotropic medications don't get them. Okay. So they wind up in terrible circumstances. Okay. So yes, we probably should do some training. I'm sure that the medical students receive some training on how to taper their patients off of SSRIs. But the real problem here is access to those medications.
Under prescribing and no access to
Yeah.
life-saving
God.
medications.
My Jesus. I mean, it was not the most responsible performance that I've ever seen.
Well, and there's been a lot of it was not received well, from what I understand. I mean,
No.
There's a few Mahas, like the Maha moms on Instagram, who were like, "You go," but from what I've heard, like broad, significant criticism.
Oh yeah, and then like the folks in Washington, like us, and I represent mostly mental health patients. Mostly represent mental health organizations. We're like, we don't want to
Not what we need right now.
we don't want to get the administration pissed off, so we have to issue statements that say, well, we need balance and.
Yeah.
We need clarity and what have you. And then they issue. So then they issue in the press release, they issued a dear colleague letter. Right? So it's not clear about this. So it's not clear who the dear colleague letter is going to, right? So is it going to prescribing physicians? Is it going to state departments of health? Is it going to community mental health centers? Is it going to state mental health authorities? Who is the dear colleague letter going to? If it's just going on their website, that's fine. It's all good. If it's actually going to someone, then that's a problem, because then that will lead to meetings and people have to say, well, what do we do with this correspondence and how do we respond to it? So it's a new adventure almost every day with these people. It is an amazing.
I feel like I'm sure, like, the one area where I can say, like, yes, I think overprescribing is likely a problem is maybe in kids who have received some kind of an ADHD diagnosis. That's kind of the only place I'd be willing to sort of like, I mean, I and even then that's a complicated area without a simple answer of like, yes, right, or no, when, whatever. And so I think if we're looking at like bigger problems, it's exactly as you said, which is just, there are so many people who could benefit from help that are not getting help.
Lisa, there is a problem with overprescribing, okay? But and again, the issue with these guys is that they just come at things with a blunderbuss, okay? So it's discrete in the psychiatric space, it's discrete areas, okay? Seniors in nursing facilities are prescribed.
Yeah, because of understaffing, because they want them to stay in their beds. That's
children in foster care, right, are also prescribed antipsychotic medications because
100%.
It's also understaffed, and these are youngsters
can't advocate for themselves and are shoved in these situations. Yeah,
and then there's a high incidence of mental disorders in kids in the foster care system. What's called multiple prescribing in the public mental health system. There are patients on multiple antipsychotic medications. That's bad prescribing. Okay, so there are discrete issues with overprescribing. Okay, so if they approached it that way, that would have been helpful. Okay, that would have been helpful. That's not the way. That's not what they did. That's not what they did, unfortunately.
It's really scary. Also, I just like you said earlier, mental health is so complex. The way the brain works is so complex, right? Like this is just such a risky place to be poking your nose in if you're not an expert.
Yeah.
The Maha Institute in general too could have been super cool, but instead, like, remember, Lisa, when we went to their thing and they had the girl up there that was saying that poor people in Mississippi should just stop on the farms on the way to the Walmart and pick their own vegetables. And I was like, you might be the dumbest person I've ever heard speak in my life. Like, I just think like they just, like you're saying, Al, could have been approached differently and useful. And instead it's like, bah!
Oh my God.
Bah! Yeah.
Nothing that should be approached with a scalpel. With these folks can't be approached with a baseball bat, and that's their approach. Now, Kat, Lisa, last thing. AI. Oh my God.
Oh my God.
Oh my
Let's
God.
talk about it.
Oh my God. Oh my God. Oh my God. So, and I have the hardest time because again, most of my clients are in the mental health space. Okay. So when I go up, when I talk on Capitol Hill about AI, there is a world of use cases in the AI space in mental health. All congressional staff want to talk about are chatbots. Okay. So I want to talk about it. And in fact, there are tragedies with chatbots, and these are consumer-facing chatbots. There have been suicides, episodes of psychosis, and it should be regulated. Is it going to be regulated with this Congress and this administration? No. Those algorithms have to be subjected to regulation at the federal and state level, likely by the FDA and other regulatory bodies. Is that going to happen? Probably in my lifetime? No, that's not going to happen. All right, but that needs. But but there's this other world of the utility of AI in the mental health and addiction treatment space. They don't want to talk about that stuff, and so the concern that I have is that I am responsible for getting the useful stuff paid for, and so when you talk to congressional staff about this, they don't want to talk about that. They just are focused on these tragic incidences, and I am unable to get them focused on the non-chatbot stuff. So here's what happens. I'm with a member of Congress 2 weeks ago, and his staff. Okay, they're introducing a bill on how to pay for AI and in healthcare. And the way this legislation works is they pay for specific use cases. Okay, that's the way that works. So the legislation is going to pay for radiology use cases, a few other odds and ends, and dermatology use cases. I can't get them to pay for AI use cases. Dermatology, yes. Mental health, no. That's what's happening now because this chatbot stuff is blotting out the sun.
Yeah.
A rational conversation with decision makers on Capitol Hill about AI and mental health because of this chatbot stuff, the stuff that's happening in Pennsylvania.
The character AI thing. Yeah.
You previewed it earlier in the program. It's infuriating. I know that it's hard for your audience to sort of wrap their mind around it. For people like me, it's infuriating. Really is.
Well, what use cases would you want to have funded in behavioral health?
There's stuff like AI Scribe, right? Is one. There's this really cool application. It is an AI video technology that can screen for tardive dyskinesia. It's a movement disorder that's caused by older antipsychotic medications for people with schizophrenia. So it's and it takes a psychiatrist 30 minutes to administer what's called an Ames test to determine whether or not you've got it. This can do the screen in 20 seconds. So there's all of this really cool stuff that doesn't have a payment mechanism for it.
Right.
And I just can't get it's because
scribing, like you said as well, like scribing is a whole area in mental and behavioral health delivery where there aren't like appropriate, scribing tools in many cases. There's some, like, I know that Simple Practice and other EHRs that are in the space are trying to like build and deploy this, but they can't use like the standard stuff, right? They have to, so there's just like all kinds of questions about how to make this easier.
Yeah. Oh my God, yeah. But when I talk to congressional staff and say, I don't care about chatbots, that's somebody else's problem, they tell me, no, we care about chatbots. So you have to assure us, you have to give us the solutions to chatbots. And after that, we'll talk about what you want to talk about.
Okay, this is where I need you and Lisa. So do we need a law to get AI reimbursed for?
Yes. Oh my God, yes.
I thought we didn't. I thought that could also be done via CMS.
Well,
what do you mean?
Like I thought CMS could just be like, we now pay for AI. Can they not do that, Lisa?
It can, Kat, it can, but
they're not going to do it
They're
without
not gonna do
pressure
it.
from
Okay.
Congress is my interpretation. Al is the expert there, but that's how I would describe it.
Yeah.
If Congress said we need to figure out how to get more technology to improve access to mental and behavioral health care, I'm guessing that's what Al is going for.
Yeah.
well, and Kat, they're going to do it
Hantavirus, sorry.
one step at a time, and they're going to do it use case by use case, and they're going to do it the radiologies first, right? So they're gonna it's a political process at CMS, right? So it's as much political as it is substantive, right? So they're going to do it one step at a time because they don't want to make an impact on the federal budget. So it's and if every time someone brings up AI and mental health and it's chatbots and people dying, then that reduces the desire of CMS to cover AI and mental health use cases. I think that's the problem. Yeah.
Right. Well, what should we do? Like, is there anything that our loyal fans can do? Because I mean, those do sound like good use cases, right? Like, what can be done?
Well, Kat, I'm trying to get I'm trying to get bills introduced that will pay for this. So perhaps when you have me back, I will have a bill introduced that the listeners of this program can call in and
we love that. Well, you can come back anytime you want. You're our favorite lobbyist for now.
Oh my God, yes. And very few people have favorite lobbyists, as a matter of fact, Lisa and Kat. So I mean, just to let you know, according to widely shared public opinion data, lobbyists are below telephone solicitors and used car salesmen in public popularity. There must be some confusion.
I think so. Yeah, they probably haven't met you yet. That's probably it. Well, that's wild. Well, thank you for being our personal behavioral health policy expert. Al, what do you want to leave our loyal fans with? Because it's like the weekend. We got to go.
I want you to take care of your mental health out there. And, my hope is it's going to be a beautiful weekend where you're located.
Mm-hmm.
Get out there and enjoy yourself. Okay. We spend too much time in America looking at phones and not enough outdoors.
That's right. We're pro nature over here. Yeah. And it's Mother's Day. So either think about your mother, think about yourself if you are a mother, or just be a nice person generally.
What would your mom say?
Thank you, Kat.
Yeah.
Thank you, Al. You're the best. You're a favorite lobbyist.
Thanks, y'all. Happy weekend.
Bye, everyone.